Welcome. I'm here with Dr. Donese Worden, and today we're going to be talking about enzymes. In our last two segments, we talked about digestion, we talked about parasites, really fascinating, useful information. If you haven't seen those, go back and take a look because this is kind of a progression because we're entering cold and flu season now, and everybody needs to have the best guts going, especially coming into the holiday season because we're going to trash our bodies with simple carbohydrates and sugars. Yikes. So I'm sure she's going to admonish us just a little bit on that. So anyway, let's go to Dr. Worden. Hi, Denise. Good to see you.
Hi, good to see you. No admonishments. I say eat healthy 99% of the time. Enjoy your holidays. Get a little sick afterwards and get back on it. It's okay. No guilt, right? But no, you did it.
Exactly.
So, and one of the things that can help us actually through the holidays, actually not even gain weight, not get so much inflammatory conditions that are happening because of the foods we're eating, and help us digest all that stuff are enzymes. And I lectured last year around the nation training doctors, and the title of the lecture was "We've Forgotten the Power of Enzymes." And we have, and we need to be utilizing them more in medicine because they're absolutely amazing. Enzymes really are proteins, and they speed up all of our chemical reactions in our bodies. And there's two main types, right? Systemic, that works on the whole body to get inflammation down. And then there's a digestive enzyme that helps us digest. We have the metabolic ones, the ones for our body. They're for each tissue and organ has their own enzymes. And so that's what we're working with when we're working there. Digestive, help our digest our food. And then our body makes its own enzymes. And food have their own enzymes. That's why when you cut an apple and it turns brown, that's the enzymatic activity pre-digesting that. That's why we can eat those things and do better than cooked food.
An Oreo does not make its own enzymes, does it?
No, it's completely dead. It's completely dead. And the sad thing is, good question though. The sad thing is that even our healthy foods, even our live fruits and vegetables, once you heat a food to about 118 degrees, so in other words, you cook it, you've destroyed all of the enzymes in it. There's no enzymatic activity. It's dead food. It's got other things healthy, but not enzymes.
Okay, so what about when our food is irradiated coming into the country?
That's it. It will not sprout. And why won't those potatoes sprout? This is just an example because it's been irradiated. It's killed the enzymes. There's no life force, no life in those foods. And the reason why that's a real big problem is because it's killing not only the enzymes, but who knows what it's doing to the DNA actual of that food itself. We don't know.
Right. Let's go back to systemic enzymes. And my understanding is also that the systemic enzymes go through the body and they eat up necrotic tissue and such. Is that true?
They are thrombolytic. They help us not form clots. They work like warfarin and Coumadin. Now, I would say talk to your doctors before everybody throws themselves off of those medications. You can't do it without doing it right. But they actually help scar tissue and help you not to form it and to release it once you have it. Uterine fibroids. I mean, I could go on. Allergies, headaches, high blood pressure, autoimmune disease. Even now, we know with the newer studies that tumor growth can be suppressed and cancer cells. So this lecture that I've been giving around to the physicians, it's phenomenal the amount of research that we have that these simple, inexpensive things can do. And you name a disease, and I could tell you that I believe an enzyme would be helpful.
To me, that almost sounds like the Holy Grail, really, if we're going to do one thing to really support our own health. But so many, they're not all made equal.
They're not. And that comes down to quality again. You know, if we've got quality of where you're getting your product, where they're manufactured. If those enzymes are not potent enough, if they're not the right form, they're not going to work well. So that's working with at least I know that we're going to do one of your shows. We're going to be talking about product safety and quality and how to look and ask those questions. But until then, rely on the doctors that they should be doing that for you. or health practitioners that ask the questions of certificate of analysis and these things to know you've got a good enzyme. Some people will come and say, well, I've tried digestive enzyme, didn't work. And I say, well, show me which ones you were on. And then I get to say, well, I'm not sure digestive enzymes didn't work, as opposed to the quality of the product was suspect.
Okay, so let's get into some nuts and bolts, because people are going to be waiting for your recommendations, including myself. So what do you think are the top, say, 4 or 5 brands in terms of quality of systemic enzymes before we move on to digestive enzymes?
Yeah, so systemic enzymes, there's a ERC. That's not something that they're going to, enzyme research company. They're a great company. Might be able to find that online. The other one is World Nutrition, which you can find in almost any health food stores. World Nutrition does a good job on their systemic enzymes, and their quality control is very good. And another new one, and again, I'm not sure how available, but it's called Empirical Labs. That is one not for systemic in a combination systemic, but for nattokinase. There's a specific enzyme that we know is made from the silkworm, lumbrokinase. Let me correct that. Lumbrokinase is made from the silkworm. It's one of the leading drugs in Japan, not natural substance, but drugs, even though it's natural. That is one of the best agents I know of to keep the blood nice and thin and from forming clots. And I use that judiciously in my patients that need that. So that Empirical Labs has a good one at a good cost, because it's quite expensive elsewhere. And they're the only ones I know that are getting the real thing from Japan here in this country. Canada RNA was another one that you can get the lumbrokinase as well. But for systemic, where you're putting a lot of different enzymes in there to try to get to a lot of different things, they usually don't have the lumbrokinase in it. So that's the problem. You've got all the others that'll work on everything else, but if you want that piece, you have to buy lumbrokinase.
Okay.
A little confusing, but the other guys haven't been able to get their hands on the lumbrokinase. There's
Okay, so
in America that can do it.
Tell me if I've understood you correctly. We have ERC, we have World Nutrition.
Yep. For systemic enzymes, those are going to be
systemic enzymes. And then Empirical Labs has systemic enzymes with the lumbrokinase, or what is it called?
It only has lumbrokinase. It doesn't have the other enzymes in it, but it has magnesium, other things. But if you're after the blood thinning, worried about blood clots, that's a good one to use.
And RNA, same thing?
Yep. Canada RNA, and they just have it straight in the lumbrokinase.
Okay. So are there any other brands that you haven't listed so far that you particularly like and use?
You know, not that I can attest to. I have the certificate of analysis. I've seen the end batch runs. I've done my diligence on these companies. There may be other good companies out there, but I know some that I would not recommend, which I will not say here, but those I can put my name behind, knowing that the last time I'm looking at them, they were a good company.
Okay, excellent. So now let's go on to tummy disturbances. Foods are bothering you. You're afraid of food now because nothing's digesting properly, and maybe you have some other issues going on after the age of 50, in particular, a little bit of flatulence and so forth. So let's talk about digestive enzymes and the best quality ones.
So for your listeners, if they've got digestive issues, they don't know what's going on, they don't want to spend the money to go find out, particulars and do testing. 2 things. I say you get yourself on a good probiotic, see what changes that makes. Then you try digestive enzymes. Those digestive enzymes need to be taken about 20 minutes before a meal. If you forget, you can take it in the middle or at the end. However, best before a meal. And if you this brings us back to systemic for a moment, that we're after inflammation and pain. Those, if you take those with food, they're going to act like a digestive enzyme because a lot of the enzymes are the same. You have to take those on an empty stomach. Digestive enzymes you take with food. So we try that out. If you do digestive enzymes and you do a probiotic and you're still having issues, you need to see someone and figure it out.
Okay, so let's talk about top brands that you can put your name behind.
Again, those same 2 companies, ERC and World Nutrition have very good digestive enzymes. So I think your listeners are going to be okay, especially they will be able to find World Nutrition in most health food stores. They can also, if there's some doctor's lines, like some of the ones I've mentioned, they could call my office and we can ship them out if they can't find them somewhere else, or if their doctor doesn't have those.
Okay, very good. So again, and this is a thing that happens with age as well. It sounds like by the time you hit 40, the level of your enzymes are starting to decline, and it continues on from there. So any final words of advice for those that are over 40?
Well, it's interesting. You're correct that after 40, in general, our enzymes start decreasing. But there's one enzyme that actually comes up as we age that helps us break down fat and other things. And so when that one increases, that's why we get not anorexic, even though that's the medical terminology, why we can start losing weight in real senior years as opposed to this middle section. So we're learning more and more that these enzyme production on our own is changing as we age. The other thing that I would say is that there's a new study that was out of Taiwan that just recently came out that showed that these enzymes may help dissolve amyloid fibrils. What does that mean? May help prevent and treat Alzheimer's. So that's a new area of research, which is fantastic. The only thing that you need to be careful of with these systemic enzymes, if a child has cystic fibrosis, it can cause a severe colonopathy with their colon. So that's the only people that I would say be wary. Others that are blood thinners, you may get too thin. So you need to let your doctor know. But helping with biofilms, if people are going in and they're getting a knee replacement or a hip, we're worried about those biofilms and those infections that start, and we don't have an antibiotic to help it. Enzymes are helping. These systemic enzymes are helping break up that biofilm. So there's a lot of interesting things.
Absolutely fascinating. And anytime we talk in the future, if you're coming across some new research on this particular topic, systemic enzymes in particular, just toss it in there as an update, because again, from everything I understand, this really is kind of the holy grail, as it were, for each one of us to be able to start working on our own, our own system.
It is one of them. It will give you energy and it will help your body age less. It is. I don't like saying holy grail, but and another thing that happens as we age, Regina, is our kidneys start having trouble functioning.
Yes.
And I have case studies now where I've put them on these with another thing and gotten them back into normal function. I'm talking 82-year-olds, 85-year-olds. That's not supposed to happen. When that starts going downhill and they're going toward dialysis, we're not supposed to be able to reverse it. It is reversing, and I've got the cases to prove it. So I love enzymes.
That's good job. I find it fascinating. And this is going to take us into the subject we're going to talk about next time. But just for now, so we pick up a bottle of these enzymes through World Nutrition or whomever, okay? And we look at the label. Do we take the amount recommended on the label, or is that generally a midland or an insufficient amount?
Well, if they go to that website, World Nutrition website, there's a doctor's line that patients can't get unless they get it from their doctor, but it gives them a guideline of how many to take for what conditions.
Okay.
So they would be able to get that from the company, I believe.
Okay, that's really good news.
On the bottle, unless you're under care of someone who knows what they're doing with it. And we take sometimes 2-3 times a day to get the inflammation down. Then when it's calmed down, then we can go to just 2 a day is the general recommendation.
Any final thoughts before we sign off?
No, I just say anytime we can speed up chemical reactions in our body and make us work better and feel better with something that doesn't have negative side effects, we need to consider it. And enzymes are one of those things.
Thank you, Donese. Again, Dr. Worden will be back with us talking about how to read labels on the side of those vitamin bottles and other supplements as well. Until next time, thank you for joining us here on reginameredith.com.